Hello, today is the day 233 of 365 days project and I am here to continue about the diagnosis of colorectal cancer. Nearly all cases of colorectal cancer begin with the growth of polyps or benign growths of the tissue in the intestine. If these growths are detected and removed early, the development of the colorectal cancer can be prevented. Men and women over age 50 are at average risk should be screened. Other family members of the individual with colorectal cancer should be screened 10 years before their family member was diagnosed with a cancer, or even if no genetic mutation was found. A number of tests available to screen the colorectal polyps or cancer, which are fecal occult blood test. This checks for the occult or hidden blood in the stool. Flexible sigmoidoscopy. In this examination, a doctor examines the inside of the rectum and lower portion of the colon through a flexible lighted tube. The doctor may remove the polyps and collect the sample of the tissues or cells for the closer examination. Colonoscopy. Colonoscopy is used to detect precancerous colon polyps before they become malignant. In this examination, a doctor looks at inside of the rectum and entire colon through a flexible lighted tube. Double contrast barium enema. The patient is given an enema containing a dye, which is barium, followed by an injection of air. X-rays of the rectum and colon are taken. The barium outlines the intestine on the X-ray so that the polyps and abnormalities may easily find. CT colonography, virtual colonoscopy also known as. This is an non-invasive way to visualize the colon using a CT scanner. The main disadvantage is that if something abnormal is seen, the patient needs a regular colonoscopy or sigmoidoscopy to obtain a biopsy or remove a polyp. Patients should speak with their physician about learning the screening method that is the best for them. These examinations are important not only to determine the extent of the current problem but also to find other abnormalities. Additional tests were blood test, CT scan, and transrectal ultrasound. Treatment. The primary treatment for the cancer cancer of colon and rectum is surgery. For the cancer, they have not spread. Surgery alone often provides a pure care. Our surgeons are international leaders in removing the lesions with the spread, particularly to the liver. Increasingly, we are now able to provide a cure to selected patients in this situation. Surgery. If cancer is confirmed with a polyp that can be completely removed through the colonoscopy, no other therapy may be necessary. Colectomy. The vast majority of the people who develop colon cancer will require surgical resection or removal of the segment in the colon or the rectum. Laparoscopic surgery. Laparoscopic surgery is the standard of the care for the majority of the colorectal procedure. Compared to open surgery, the benefits of laparoscopy include less post-operative pain and therefore less pain medication, faster healing for quicker return home, small, less noticeable scars. What is a stoma and will I need one? A stoma, commonly referred to a colostomy or ileostomy, is an artificial opening in the abdomen created during the surgery that allows an elimination of stool after the operation. Robotic surgery. There are nerves in the pelvis that control sexual and bladder function. This technology allows us to more carefully identify and preserve the nerves. Chemotherapy. Chemotherapy drugs are given to kill the colorectal cancer cells, which are 5-fluorouracil, often with the vitamin folic acid, capitolamide in pile form, irinotecan, oxylopathin. Targeted therapies. VEGF targeted drugs, EGFR targeted drugs, and radiation therapy. Recovery. Malignant tumors can spread to other parts of the body if untreated. The chances of the complete cure depend enormously on how early the cancer is diagnosed and treated. Thank you.